Bismillahirrahmanirrahim. Today we will discuss about the tumors of the esophagus. So most of the tumors of esophagus, they are carcinomas. That is adenocarcinoma and squamous cell carcinoma. Although there may be some other tumors which are very uncommon, and these may be some So adenocarcinoma and squamous cell carcinoma, they are the most common. Other less common tumors, undifferentiated carcinoma, carcinoid tumor, melanoma, lymphoma, sarcoma, and some other benign tumors like leiomyoma in the wall of the esophagus. They may also occur, but most common they are adenocarcinoma and squamous cell carcinoma. So adenocarcinoma, there are certain predisposing factors in the development of adenocarcinoma. That is Barrett's esophagus, GERD, that is gastroesophageal reflux disease, tobacco smoking, obesity, radiation therapy, and Caucasian persons. Male to female ratio is 7:1. So pathogenesis of adenocarcinoma. So molecular studies suggest that progression of Barrett's esophagus to adenocarcinoma occurs over an extended period through stepwise acquisition of genetic and epigenetic changes. So there are mutations of P53, and initially there is Barrett's metaplasia, which persists for longer periods of time, and this is followed by various grades of dysplasia and then adenocarcinoma. So mutation of P53, then CRB2, cyclin D1, cyclin E1, RB gene, and P16 INK4A. So these are the different types of mutations which occur in the pathogenesis of adenocarcinoma. So here you can see the progressive development of adenocarcinoma. So first is, this is the normal squamous epithelium, multiple layers of different types of cells in the stratified squamous epithelium. So initially there is esophagitis and then Barrett's esophagus, replacement of squamous epithelium by intestinal type glands or columnar cells. And this Barrett's esophagus develops dysplasia, and dysplasia is followed by development of invasive carcinoma, adenocarcinoma. So morphology of adenocarcinoma, the commonest site of esophagus is the distal third of esophagus, and there may be raised patches, and tumor may be 5 centimeter or more, and there sometimes there is diffuse infiltration of the wall, and microscopically there are glands, well-formed glands lined by malignant cells. This is the endoscopic appearance of adenocarcinoma. There is a well-formed mass formation in the lumen of the esophagus. So that is about the adenocarcinoma. Clinically, these patients, they present with pain or difficulty in swallowing, progressive weight loss, chest pain or vomiting. And by the time the sign symptoms appear, the tumor has usually invaded the lymphatics. So as a result, the patients present at advanced stage and the overall 5-year survival rate is less than 25%. Squamous cell carcinoma patients, they are over 45 years of age. Male to female ratio is 4:1 and predisposing factors, they are alcohol and tobacco smoke and sometimes nutritional deficiencies and exposure to polycyclic hydrocarbons, nitrosamines, and other mutagenic compounds such as those found in fungus contaminated foods. They are also suspected risk factors. Then esophageal squamous cell carcinoma may be seen in HPV high risk patients, high risk group of human papilloma viral infections, but not in low risk groups. Pathogenesis, mutations of P53 and P16INK4A. So these are the molecular alterations and morphology of squamous cell carcinoma. Unlike adenocarcinoma, squamous cell carcinoma is seen most commonly in the middle third of the esophagus. And this starts as an in situ lesion. Initially, there is plaque-like thickenings of the mucosa, and later on there is polypedal or exophytic mass formation in the lumen, which may obstruct the esophagus. And sometimes there are diffusely infiltrated lesions. That is, wall is infiltrated and there is thickening and rigidity and luminal narrowing. These cancers often invade the surrounding structures like respiratory tree, which may lead to pneumonia, aorta, which may lead to severe hemorrhage, or mediastinum or pericardium. Grass appearance. Here you see a fungating mass lesion in the lumen of the esophagus, and most commonly they occur in the middle third of the esophagus. And this is the microscopy. So there is an invasive squamous cell carcinoma. Often they are moderately to well differentiated, but sometimes they may be poorly differentiated. Spread of squamous cell carcinoma depends on the location of the tumor. Cancers in the upper third of the esophagus, they metastasize to the cervical lymph nodes. Those in the middle third, they go to the mediastinal or paratracheal or tracheobronchial lymph nodes. And those in the lower third, they spread to the gastric and celiac nodes. So the spread, distant spread depends on the location of the tumor. Then these squamous cell carcinomas, they may show some variations in their cellular composition. It may be sometimes verrucous carcinoma or sometimes spindle-shaped cells, that is spindle cell variant, and basaloid cells, basal cell carcinoma. So that is about the tumors of the esophagus. So most common tumors, they are adenocarcinoma and squamous cell carcinoma. So that is the tumors of esophagus.